As you know, occupational therapy as a healthcare profession does not work only in isolation. One important statement that exemplifies this is in the occupational therapy practice framework. The statement reads, quote, "Achieving health, well-being, and participation in life through engagement describes the domain and process of occupational therapy in the fullest sense." This video will introduce you to these important concepts of health, wellness, and participation, the category of patient-reported outcome measures commonly used in practice, and why we use them in the first place. I'm Jeff, the OT dude, and let's get functional. According to the AOTA, achieving health, well-being, and participation in life through engagement describes the domain and process of occupational therapy in the fullest sense. I think this is such a great quote because it ties occupational therapy back to its role among the other healthcare professions such as medicine, nursing, psychology, physical therapy, speech-language pathology, nutritionalists, acupuncturists, personal exercise trainers, and the list goes on and on. As occupational therapy practitioners, we're all familiar with the term occupation, but it's worthwhile to reiterate the definition of the other three major keywords mentioned in the statement: health, well-being, and participation. And the AOTA and the OTPF reference the World Health Organization for these definitions. The WHO actually has what's called the Constitution of the World Health Organization. The first principles in this document for the Constitution outlines health and defines it. We know it's important as it's called the World Health Organization too, right? So health is defined by the WHO as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The definition of infirmity is physical or mental weakness. Intuitively, we all know then what it probably means to be healthy, and so this definition should be no surprise to you, but notice that they mention physical, mental, and social well-being. So as occupational therapy practitioners, this is what I believe to be one of our strengths as we receive a strong educational foundation in the mental, physical, and social theories, and we practice them in our interventions, and it's within our scope of practice. By the way, if you are unfamiliar with our scope of practice, I have a video explaining that in a lot of detail on this channel. Okay, what about well-being? What is mentioned in the first definition of health, right? It's kind of like the movie Inception where well-being is part of the definition of health. And so it's like, what does the definition of that mean? Well-being is defined by the WHO as a general term of encompassing the total universe of life domains, including physical, mental, and social aspects that make up what can be called a good life. Notice again what keywords are mentioned in this second definition, which is like a subset of the first definition: physical, mental, and social again. So this means that these three things are very, very important if they're mentioned again and again. But the last part of well-being, really what's kind of defines it, is a good life. To me, this means it is kind of subjective. And to take it even one step further, it means that it's to be client-centered. What does a good life mean to someone in America as opposed to, say, in another country, for example? The AOTA statement mentions a third thing: participation. And we use this term a lot in everyday language, but especially in occupational therapy. You're probably really familiar with it when it comes to the context of, say, engagement, such as participation in occupations. How participation is defined, by the way, by the WHO is, quote, involvement in a life situation. So also quite intuitive. So far, this is all very intuitive, right? And reading this in the OTPF, you would probably want to move on to the next page of the document, having understood these concepts and the point of why they are there. But before you click off of this video, I wanted to take it one step further. And one helpful way to think about these definitions is the possibility of how you can approach the theory and interventions for practice. Take in pediatrics. You're working, say, in a pediatric setting, like a clinic or a school. Just because this is not a traditional mental health setting, the statement from earlier, right, means that we can also utilize the mental and social supports as well. So addressing the child's psychosocial barriers can actually promote engagement and maybe the answer to more engagement in activities such as play if they, for example, the child doesn't feel safe in the environment around their peers, mentally or socially, right? And how it affects their behaviors. The same could apply to the physical disabilities settings in the hospital, outpatient, home health, skilled nursing, and other settings for adults and geriatrics. And in mental health settings, it's not like there's no physical or social either, right? There's a social milieu, and clients are participating in physical activities from the moment they get up out of bed to the moment they are in bed and sleeping, or maybe not sleeping if they're like suffering from insomnia, for example. Even sleeping itself, the research shows, right, has physical and social benefits. We learned in some of the earlier videos on this channel about the importance of outcomes. This is a major part of our scope of practice as occupational therapy practitioners, as outlined in the AOTA's scope of practice document, as well as the occupational therapy practice framework itself. Outcomes, right? So the question then is, how do we know we are helping our clients or achieving their health and wellness? How do we measure our own success as practitioners for these kind of factors? Remember that wellness has the keywords good life, so there is a degree of subjectivity here. So this means that measures such as the COPM, Canadian Occupational Performance Measure, can be very valuable and insightful tools to measure success in occupational therapy in the eyes of the client. But remember how the World Health Organization was used for defining like health and wellness? So it would be very tunnel vision of us as occupational therapy practitioners to solely use OT like oriented outcome measures and ignore what's going on in the rest of the healthcare world. So what about a universal language then, or a measure outside of occupational therapy? Because it is important to communicate with other healthcare professionals and to have a standard with a common and standard language. When I first did a search in the literature, I was actually surprised to not find something right away that measured health and wellness in this sense based on the keywords that I searched with. But I dug deeper and deeper, and I eventually found out about PROMs, PROMs. No, not passive range of motion, but patient-reported outcome measures. You may or may not have heard of some of these in OT school, but technically, the COPM is considered one of these PROMs. These overall are important, I think, because you may encounter them in practice, and they are very, very useful. And it's better to somewhat be familiar with it, at least aware of them before you say are maybe like asked to administer it or scrambling to find one. And so I will present you with some really good ones that are widely accepted. They have good psychometric properties from research and so on. I'll start with the one that I've seen like most frequently used and am very familiar with, such as from my rotation for mental health, and that's the PHQ. In particular, the PHQ-9. PHQ stands for Patient Health Questionnaire. And the 9 in PHQ-9, you may be tempting to think that's like the 9th version, but sometimes in these outcome measures, this notation can also be used to describe how many questions are asked in the questionnaire itself. So that's really cool because you can quickly see the name. And it's like, okay, PHQ-9, there's 9 questionnaires. I don't have a lot of time with my client, so I'm going to bust this one out and use it. The PHQ-9 is primarily used in the mental health context in terms of like what it measures, although it can be used in like other settings. And it primarily is intended to screen for depression, things like suicide ideation based on sadness, lack of interest, fatigue, and changes in appetite and sleep. What's funny is I've been asked to fill this out when I go to do a normal checkup at the doctor. So I'm like, hey, in my head, hey, I know what they're screening for. So have you been asked to fill out the PHQ-9 before? But on the flip side, one way that I do see the PHQ-9 being used is systemically. Maybe everyone is administering it left and right. And the question is is it being used correctly, right? What it's intended for. They may or may not follow up with obtaining the necessary information and following up and just providing the interventions and what's needed after the screen. A similar one along these lines as the PHQ-9 is the GAD-7, which stands for Generalized Anxiety Disorder 7. So 7, you probably can guess 7 questions. And just like with the PHQ-9, I think if this is being used quite frequently also to follow up, right? Asking more questions if it's within your scope, and if not, referring out, making sure a patient is being addressed for conditions such as GAD, which I think is quite common these days in modern society. Okay, the SF36. This is a good one. This stands for short form survey and is comprised of, you guessed it, 36 questions. What's nice about it is that it covers many domains of health, from the physical to mental to social functioning to even pain and like vitality and energy, or opposite, fatigue, and also the general health perceptions of the client or the patient. So then, in terms of professional reasoning, why don't we just give everyone the SF36? Why do we even bother with the PHQ-9 or the GAD-7? Well, for one, the SF36 is much more longer. It has 36 questions as opposed to like 9 for the PHQ-9. Second, if you already say like measured for some of these factors already, like you want to get at maybe like the mental health components, then maybe the PHQ-9 or the GAD-7 may be more appropriate, as they're very specific in their own right. So it's kind of nice to have all of these different measures, from the very general such as the SF36 to the more narrowed and specific PHQ-9 and GAD-7. And also there's also a shorter form version of the SF36 called the SF12 for situations where even shorter questionnaire is needed. But keep in mind that one downside to, like, say, a shorter questionnaire, even within the same version, is it may not be as sensitive to asking as many comprehensive questions, right? It's abbreviated. You may not get as much information out from the client as opposed to a more comprehensive question set. Also, there's something called the RAND 36, which is actually a modified version of the SF36 with different wording and phrasing of the questions. Another one is called the PROMIS, PROMIS, without the E. It's easy to remember for being one of the patient-reported outcome measures, as it's in the name and the first letters of the abbreviation. PROMIS, it stands for the Patient-Reported Outcome Measures Information System, and it's a comprehensive measure of the physical, mental, and social health components, similar to the SF36, but it also covers areas such as pain, fatigue, anxiety, and depression. And what's nice is that it also includes sleep and sleep disturbances, which is, we all know as OTs, rest and sleep are very important as its own like occupation in the OTPF frameworks domain. And while the SF36 has 36 questions, the PROMIS, on the other hand of the spectrum, I don't even know how many questions it has. It has like banks upon question banks of questions, and is like even separated for pediatrics to adults. So although the PROMIS is very nice and comprehensive, it's less likely though that you'll be able to access this measure due to the cost, training, and time for administration, unless your organization has this resource and you actually have the time to administer it. But it's worth mentioning because it's out there in the wild, and something you should know about. Next is the EQ5D, which is how it's abbreviated, or the WHOQOL 5D, which is an instrument for measuring quality of life. That's what the QOL stands for, with factors such as mobility, self-care, pain and discomfort, anxiety, and depression. This self-completion questionnaire, it's interesting as it features one section, the EQVAS, which stands for the Visual Analog Scale, for rating one's health from a scale of 0 to 100. There's also a version based on your age, such as for children, while retaining all of these 5 domains. And in looking at the EQ5D, it really reminds me of like the Barthel Index in terms of like how the question are asked and how the patient answers. The modified Barthel Index you may probably have heard of actually is very often used in settings such as inpatient rehab, and it covers many of the occupations such as feeding, personal hygiene, bathing, toileting, bowel and bladder, dressing, stair climbing, ambulation, and transfers. That's a lot. While not as universal as the other PROMs, you will likely encounter it in settings such as the hospital or skilled nursing facility. And I think the questions are also quite well aligned with, say, nursing, even though they may not be necessarily administering it. It's intuitive. They understand it because they ask questions like that are pertinent to their scope of practice and how the patient answers it. It's not like this like terminology lingo that we don't understand. You need like a manual to reference. And last but not least is the WHO's quality of life, or the WHOQOL. According to the WHO, this measure was developed with a group of 15 international centers in an attempt to develop a quality of life assessment that would be applicable across cultures. And that's really cool. What is nice is that there's even like different language translations available. As it is a joint research effort, it also has really good psychometric properties. And the domains of the WHOQOL include the physical capacities, psychological level of independence, social relationships, and very interesting, Also the environmental, physical safety, financial resources, transportation, so like community mobility, and even participation for activities such as recreation and leisure. So I like that a lot. It's very, very holistic, at least how it sounds on paper. So this aligns very well with OT. And last, it also even measures spirituality, religion, and personal beliefs. So you'll find a lot of these like components inside the OTPF, right? There's a 100 question version, and there's also a BREF version, which sounds like brief, with a shorter version that has only 26 questions. To administer like the 100 or even the 26, there's like a really large manual. It's like over 100 like pages long for the administration manual, and also scoring, at least for the 100-point version, seems very, very involved in like math that's like you probably don't want to do, but it's out there. And the 26-point question version is probably going to be much easier in terms of administration and timing and scoring and all that. And what's also really cool, and I don't think I've seen this in the other measures, is it asks questions about like sex and bodily appearance perception. So that's really, really cool. So in summary, health and wellness participation in occupations is an important part of not only OT, but healthcare for our clients, groups, and populations. One way to know if we are doing a good job as OT practitioners is with outcome measures. And there are many free, well-researched, and widely used ones available that you can easily obtain and administer with your clients. In terms of like professional reasoning, there's no like one best one out there, and each have their own strengths and their limitations. As an OT practitioner, the question becomes, well, should you stick to OT-themed resources like the COPM, or should you also consider more general collaborative ones? There's no right answer to this, as this depends on the setting that you work in, your organization, and whether some maybe other healthcare providers or colleagues such as nurses are already administering this in the first place, all the way down to like the individual needs of the clients and their own goals. Not all clients may have all the time to say, fill out the WHOQOL, like the 100-point version. But on the other hand, clients may benefit from a holistic and comprehensive questionnaire of the 100-question version. So if this video has exposed you to the world of PROMs and their benefits to OT practice, please give this video a thumbs up, subscribe, and share this with your colleagues. And also let us know in the comments what you are currently using in OT practice outside of the OT specific ones to measure health and wellness. Also, if you are curious and like maybe even looking for something to do, why not fill out one of these for yourself to gain some insight into your own health and wellness and quality of life. Thanks for watching and have a nice day.